We continue our conversation with Dr. Tiffany Born. We insert one news note here. This week, Governor Tony Evers extended the Safer at Home order through May 26th, and that takes us through Memorial Day weekend when everybody thought they'd all be getting together. That's the opening of summertime usually, so as if things weren't bad enough, now it's the stay at home is extended. Doctor, we mentioned people being alone, being at home, thinking that there is something wrong with them. What do you say to that person who's watching right now thinking, everybody else is fine and I'm not? What's wrong with me?
Well, first of all, I would say that's not true. Everyone that I've talked to and everyone that I know, including myself, is struggling with this. This is not something that we're used to dealing with, and this is very new and comes with a lot of changes. If you're struggling more than you think you can handle on your own, please reach out to friends and family. I'm sure you'll find in doing so that they're feeling very similarly and are willing to talk with you and connect with you. But if that's not enough, please don't hesitate to reach out to a professional. Having someone to talk to or do a video or virtual visit with can be really helpful in these times. Don't go about it alone, because there's a lot of people to help you and we're all in this together.
And when we do have social interaction, as limited as it may be, it's usually at the grocery store, it is at work if you are considered an essential employee. And these are people that you have talked with for years at the grocery store. You've talked to people for years, obviously, at work. And they are, in most cases, some of your very dearest friends. But now, since this coronavirus hit, now when somebody gets close to you, it's like, stay away, stay away. And it's almost like we've lost our friends. A little bit of our relationship is gone. What we still have to remember, we like each other still. We're still friends, but it's a different world, right?
Yes, absolutely. It's a really odd feeling to be in the grocery store and when you normally would hold the door for someone or say hi, feeling like you have to stay apart, and it feeling like people are kind of scary and that they are not people that you shouldn't be near them, because right now we have to have that physical distancing. But reminding ourselves that it's just the physical distancing. It's not the emotional or the social distancing. It's not being able to connect with people. It's just we have to stay apart at this time, which is really hard.
Yeah, how many times have you almost given that hug? Have you almost given that handshake? And you go, oh, wait, I forgot. There are people, there are folks on the front lines of this pandemic, the healthcare workers especially, and they've got to be going through some crazy emotions right now because it's their job to be at work, to take care of people, but they run the risk of catching COVID-19 and then bringing it home to their families and their kids. What kind of emotions are they going through now?
Well, first of all, I echo what's been said throughout our community and saying thank you to those frontline workers. We really all appreciate you. What's going through their minds right now is the same things as everybody else, but so heightened because they have more anxiety of that day-to-day. They're doing their jobs, which they know very well, but under much different conditions than normal, trying to keep their patients safe, but also keeping themselves safe and healthy, as well as their families, which you mentioned. And it can be isolating for them as well to be hearing, well, stay at home and be at home, and everyone's supposed to be doing these things, but they are those essential workers that are still having to go and put themselves on the line every day. So
what advice might you give to them as far as dealing with this on a day-to-day basis?
I know that there are a lot of resources and therapists and counselors available to talk to our healthcare workers. I know that it can be very challenging to reach out when you're already working such long hours and feeling so overwhelmed, but taking that time to reach out and talk to someone can be very helpful. Staying connected with your peers and your coworkers at work and engaging in activities and talk about other things other than COVID-19 and the responses. Finding humor in things. I've seen a lot of Facebook memes and videos about nurses and healthcare workers doing funny little dances or skits, looking for the good in things, looking for the good in the community, and noticing all of the people who are behind them, noticing those signs that say healthcare workers are heroes, and the chalk drawings by children in the neighborhood saying thank you can help.
Dr. Born, I've got about 30 seconds. General advice for everyone out there watching our program this morning to get us through this thing.
I'd say we're in this together. If you have a lot of different feelings, that just means you're normal, and it's okay. There's a lot of different ways to deal with it and cope, but just understanding that you're normal and it's okay, and we will get through this and we'll get to a new normal.
Dr. Tiffany Born, licensed psychologist with Bellin Psychiatric Center. Once again, thank you so much for joining us this morning. A lot of good information. You set a lot of people's minds at ease today, so thanks once again. And if you have a newsmaker in your town you think we should have on this show, let us know about it. Send us an email at tips@wearegreenbay.com or message us on Facebook. And be sure to join us once again Sunday morning at 7:30. Until then, have a great day.